Also want it to be an orderly and respectful one. As tempted as I might be, all defamatory, abusive, profane, threatening, offensive, or hate speech are strictly prohibited. Candidates or moderators that engage in this behavior will be removed from the forum. Here are a few additional ground rules for the candidates. Number one, please remain muted if you are not answering a question. This is also important for audio issues as well as video focus. Please do not forget this. Number two, each candidate will have 2.5 minutes for their opening statements. We will ask you to deliver that statement. Number three, when questions are asked, the candidate will have 3 minutes to respond. And just so you know, we will ask 4 questions with a short break, time permitting, and each candidate will have 3 minutes to answer each question. Number 4, after the questions are complete, the candidate will have 2.5 minutes to deliver a closing statement. And we will then ask you to deliver that closing statement. And last but not least, please be courteous and conscientious of time. Throughout the forum, when speaking, if you're within 30 seconds of your allotted time, the staff will send you a notification. If you go over time, we will send a chat to let you all know that the time is up. And lastly, if you persist in going over time, you will be muted, but I don't anticipate anybody will do that. So with that said, with those rules, we're going to start with the opening statements. So we're going to begin with opening statements. When called upon, you have 2.5 minutes to introduce yourself. And looks like we're going alphabetically because Representative Dexter, you have 2.5 minutes. Please, your opening statement.
Thank you so much. I'm so grateful to the Urban League and to you, Mr. Mundy, for doing this. And thank you, Jennifer. My name is Maxine Dexter. I am a mom, a physician, and a former state representative who is really grateful to get a chance to have this conversation and grateful to Joanna for continuing to participate. It's been just a delight getting to know you better through these. As a pulmonologist and critical care physician, I've spent over 2 decades listening to patients, looking at the science, and finding solutions to improve their individual lives. Caring for people is what I do. It is what has driven me to find solutions and to be partners in my community. I see firsthand, also through this work, how Oregonians are struggling to live healthy lives. And a lot of that is reflective of bad policy decisions that we've made at different governmental levels. I see it when I'm letting a parent know that their child has accidentally overdosed with fentanyl, or when I'm helping an unhoused person try to find a place to recover when they're finally stable to go home, or rushing to the ER to help somebody who's had no access to insulin and is in a diabetic crisis. We can solve these problems. Our government has done big things, and we just need to listen to people, to look at the science and actually get some things done. That's why I ran for the Oregon State Legislature. I know we can do more. We can do more. We've done more, but we need Congress to start getting to work. Since joining the state legislature, I've prioritized some of the strongest protections for abortion rights throughout our state. We've passed budgets to allow our state to require Oregon utilities to reduce greenhouse gases by 90% by 2050. We've passed historic investments in housing to address our homelessness crisis. And we've secured $25 million for the Albina Vision Trust to help right the wrong of decimating the Albina neighborhood. We are going to do a lot more things, and we need to do it in partnership with our government delegation in Congress. And that's what I'm going to do. Partner with our communities, make sure we prioritize the needs of our community, and get work done. Thank you so much. I look forward to the conversation.
And thank you, Representative Dexter. Joanna Harbor, you have 2.5 minutes for your opening statement. Thank you.
Thank you, and thank you to the Urban League and its partners for bringing this forum together. My name is Joanna Harbor, and I live in Estacada. I graduated high school from Estacada. I got my bachelor's degree in Idaho and my Juris Doctorate degree from Willamette University College of Law. I passed the bar in 2003, and from 2004 to 2017, I had a small firm in Estacada where I did a variety of cases, divorces, estate planning, adoptions, business formation, and more. And in 2021, I reactivated my law license. 2022, I did mostly nonprofit work. And in 2023, I started doing estate planning and family law, as well as still working with the nonprofits. My background is advocating for my clients. I'm ready and able to go back to DC and represent the people of CD3 and use the skills I've learned as a lawyer, being able to read and write laws, being able to negotiate and reach settlements, listening to my clients, hearing what their problems are, coming up with solutions and implementing it. I will take these skills back to DC to head Congressional District 3 in a new direction, a direction of prosperity, safety, and freedom. CD3 has had the same leadership for decades and none of the problems have been solved. Times are hard. People can't afford gas and food. People shouldn't have to make choices between buying food or paying their bills. And especially in a country like ours, we need to end inflation and fix the economy to be vibrant again. We also need to have safety in our neighborhoods. No one should be concerned about safety. Laws must be enforced. We need a new direction. And I'm interviewing for the job to go back and represent the people of CD3. And so I ask for their vote. My name is Joanna Harbor. Thank you.
Thank you. Thank you, Joanna Harper. We will now begin the question portion of our forum. You will each have 3 minutes to respond to each question. So here is question 1, and it's going to start with you, Joanna Harper. While inflation is slowly returning to pre-pandemic levels, the price of food is still rising. Housing is becoming increasingly unaffordable, and bankruptcy filings have increased 37.4% just between 2022 and 2023. If elected, how will you prioritize and advocate for economic policies to support all Oregonians? Ms. Harper, you have 3 minutes.
Thank you. I appreciate the question. So we do need to start with the government. Spending is what increases inflation. So we need to start there and decreasing government spending, balancing a budget. We need to get the House of Congress, it needs to get a budget and get everything in order, pass it to the Senate so that we can start lowering inflation. We can't expect families to do that if we're not doing that as a nation. And so it's something that we need to work on, which is going to be making difficult choices on what gets cut. But stopping government spending being so outrageous would be a benefit. Obviously, there are times when we have to spend, such as when there's hurricanes, but we should be able to balance and plan for things like that. And that has been something that hasn't happened for way too long. And so that's kind of why we're in this crisis. And so we need to be doing that, as well as looking at maybe some laws and things we can do that will help ease the pain for people in some of these areas. And it's when we go back there, whichever one of us gets elected, we're only going to be one of 435. So we're going to have to go back there and form alliances and work with people who will get these things done and fix it work with us to fix it for the people. And so it's not going to be an easy task, but I'm ready to go back there and get going on fixing some of these things so that we can lower inflation and make things easier on all the people, especially Oregonians.
Thank you very much, Joanna Harper. And Representative Dexter, you now have 3 minutes.
Thank you so much. So inflation is absolutely something that we are all feeling across the board. The problem is that it's disproportionately impacting our working families and our low-income families. I'm sorry, I'm at another meeting, so I apologize for the background noise. We don't have an equitable opportunity to deal with inflation. And even though inflation is going up, cost of living increases have not kept pace. So we are continuing to disinvest in our working and low-income families, while income inequity continues to be a growing problem. We have more billionaires and more people with extraordinary high income than ever before. And we saw this with revenue coming in at unexpectedly high levels and giving money back to the highest reimbursed taxpayers. What we need to do is invest in working families. We need affordable childcare. We need affordable housing. It's a zero-sum game for all of us, or most of us, that we have a fixed budget. And if we can relieve the costs that are disproportionately hurting people from excessively being able to get to a better job or education, we need to make sure they have stability. Food and shelter should be something that every person who's working a full-time job should be able to expect to afford. Making sure that healthcare is affordable. The out-of-pocket costs are extremely disproportionately impacting low-income families and middle income, not the lowest income. Our Medicaid system is actually working quite well. It's those who are just above the Medicaid level that are hurting the most. So what I'm going to do, we need Gresham, East County, East Portland, throughout our rural communities, we need to address the childcare deserts that we have. We need housing that is actually affordable, and we need cost of living increases for our working families. And as we do that, we need to redistribute wealth. We cannot continue to allow the richest of the rich get richer while our poor families continue to struggle.
Thank you for your response, Dr. Dexter. So now we're on to question 2, and you will answer this first, Dr. Dexter. From record-breaking snowfall in Portland in 2023 to devastating wildfires in 2024, Oregonians are having to confront the realities of climate change. Studies find that Black Oregonians and low-income groups suffer more and more often from these kinds of disasters. If elected, how will you advocate for environmental justice? Dr. Dexter, you have 3 minutes.
Thank you. This is literally part of what we're talking about with Senator Wyden here right now, is how do we address environmental impacts of climate change that is impacting disproportionately our communities of color. I have been seeing this in the intensive care unit and in my pulmonary clinic, where our marginalized low-income families are seeing higher impacts of pollution, air pollution, asthma. We know that as we put low-income or affordable housing, I should say, along highway corridors, along rail corridors, this is absolutely true in District 3. Park Rose, having a distribution center right next to an elementary school and a high school, we need to make sure that we are regulating at a disproportionate level in favor of our communities that are more marginalized at this point, because they cannot afford to have HVAC systems upgraded so that they can be safe when they're in their homes. We need to not only mitigate climate change, but we need to adapt while we are mitigating. So we need all schools to have state-of-the-art or at least high efficiency HVAC systems that can keep the air cool, warm, and clean when our kids are in school and when our community centers are places where people have to go in snowstorms and wildfires and whatnot. We need to make sure that there's community resilience centers so that people can get connected to resources when their homes are in jeopardy. We need to make sure that climate change itself is being mitigated through aggressive targets to decrease fossil fuel utilization, as well as decreasing diesel particulate matter that's being released in our communities. The climate change existential threat that we are talking about here is impacting the wellness of all of our families. My children do not believe that they are going to have a healthy environment to raise their own families in the future. We need to take action. This is not something that we can afford to wait any longer on. And I have been doing this work at the state level. We've been investing in healthy homes, in HVAC systems for schools. We need to do it at the federal level, and the resources that the Biden administration has started will need to be continued to make sure that our communities that are most marginalized get the help first. Thanks.
Thank you, Dr. Dexter. Joanna Harbor, you have 3 minutes to answer question 2. Thank you.
Thank you. As someone who had to actually evacuate in the 2020 wildfire for 28 days, I can understand a little bit. Thankfully, I was able to come back to a home. So many people were not that lucky. We need to have resources available to deal with the disasters, but we also need better communication when dealing with it. I know when I was evacuated, I had a neighbor who was in the know who told me ahead of time so we could actually gather some important things. But I got the text to leave that I signed up for saying, get out now, don't bother packing or doing anything, when I was 20 minutes down the road stuck in traffic because everyone else was leaving the town of Estacada. We need to do way better with our warning system. We need to do better with communications and the people in the middle of the disaster so that the fire departments and the emergency crews can communicate with each other. And we need to make sure resources are available for everybody when that disaster hits where they are. It needs to be in their communities, unless they're evacuated, then it needs to be where they're evacuated to. But we need to make sure that resources are available for everyone during those times. And we need to do things with regard to the wildfires. It's actually more of a forest management issue, in my opinion, that needs to be dealt with. And we need to take better care of our forests in order to prevent the wildfires. But we do have a lot of work we need to do in preparing for addressing the needs of everyone when those crises hit, making sure everyone has easy access. They don't have to drive to it. They don't have to do this because not a lot of people can't even do that, especially in a disaster time. And we can see what's happening in the hurricanes. We want to make sure that people have the resources and they're not going around without clothing that they need and food and things like that. And so basically we need to work, I think, on communication, on resources, on forest management for fire mitigation to help with those issues.
Thank you very much for that answer. And so now we've reached the portion of the program for an Urban League commercial. So thank you, Joanna Harbor. And at this time, I'd like to introduce you to the Urban League of Portland, which is led by the president and CEO, Nkinge Harmon Johnson. The Urban League of Portland is one of the oldest Black-serving nonprofit organizations in Oregon. Their mission is to empower African Americans and others to achieve equality in education, employment, health, economic security, and quality of life in areas that deeply affect the social and economic condition of Black families in our communities. It is important that our voices are heard and that they matter to decision makers. I'd also like to speak for a moment about my organization, the Coalition of Communities of Color. We're an alliance of culturally specific, community-based organizations with representation from a broad swath of communities of color. We support a collective racial justice effort to improve outcomes for those communities of color through policy analysis, advocacy, environmental justice, culturally appropriate data and research, and leadership development in communities of color. To join our work and support our efforts, please go to coalitioncommunitiescolor.org. So that's my commercial. But lastly, tonight's forum is part of a series of forums that the Urban League has hosted between September and October of this year. This is an opportunity for viewers to make sure they are ready to vote this November. As a lot of people said, this is one of the most important elections of our lifetime. And with that, we will now return to the question portion of our forum. So question number 3, you will still have 3 minutes to respond to each question. And here we go. And Joanna Harbor, you will be first on this question. In 2023, the Oregon legislature experienced the longest walkout in its history at 6 weeks long. At the federal level, the Congress is likely to be one of the most equally divided as well. Oregonians don't want partisan fights. They want action. How will you work with your colleagues to advance the needs of Oregonians? And Joanna Harbor, you have 3 minutes.
Thank you. So especially now, the makeup of Congress is very close, and we have no idea what the results are going to be after November 5th, who's going to be elected in what states. So we don't know what we're working with. So in my mind, whether I'm working with a closely one or there's more Republicans, there's more Democrats, to me, it doesn't really matter. What needs to be done is we need to be there working for the benefit of the people specifically in our district and our state, but in the whole country. In order to do that, we're going to have to form alliances. We're going to have to work together and come across the aisle to get things done. The closer the division is, the more likely that it's to happen. But in my opinion, we should all be striving to do that more often. And I'm not asking anyone to compromise on their principles. I won't compromise on my principles, but there is middle ground. There is negotiation. Oftentimes we agree more than we disagree. Sometimes the biggest disagreement is in words. It's semantics. It's it's over personal feelings. And so when I go back to DC, I plan on not working from a personal feelings standpoint, but being a professional and working with anyone and everyone who's willing to work with me to get the job done, regardless of what is the matter before us, because there will be several different matters, a lot of them extremely difficult to deal with. But as long as we're willing to work together, and I think there are more people who are willing to work together. And doing several of these with Dr. Dexter, I can say she's someone who sounds like she's ready to go back there and do kind of the same thing, work with other people to get the job done. And so basically, that's the type of mentality we need to go back there and actually get something done. And so that's what I plan on doing if I happen to be the one to get elected.
Well, thank you for that response, Joanna Harbor. And now, Dr. Dexter, your answer to question 3, please.
Yeah, thank you so much. It's such an important question. It's one of the ones that I hear the most when talking to people in Congressional District 3 and across the country that you meet. People want to know, why would you want to go to Congress when it doesn't work? And that's precisely why we need to go to Congress. We need people to go to Congress who want to get work done. And partisan politics has not served us well. We need to show up and take note of what people in Oregon care about and share, and that is vastly more in common than what we don't agree on. We can all agree we need housing. We can all agree we want schools and safe communities, and that we want our children to be safe wherever they are, but especially when they're outside of our homes. There is opportunity to work together, and I've done that in the Oregon legislature. I was a member during this longest walkout. And you get things done by showing up in the same way that I do every day in the clinic. You don't take care of Republicans or Democrats. I take care of people, and showing up and listening to what's on their mind, what they care about. What I hear very clearly is people want us to go and represent their interests, not an ideology or a party. They want us to show up as Oregonians. And that is absolutely what our delegation has been committed to doing, and it is what I will do. I will also share that I think it's really incumbent upon voters to demand that we work together. I think sometimes voters are part of the challenge, that a lot of the theatrical sort of performance that happens on the House floor, certainly in Oregon, is for the base of each party. It's it's performative. It's not the work that gets done behind closed doors. And when I negotiated the housing package and land use changes in Oregon law, I did it by bringing everyone to the table, whether it was the Urban League or it could be somebody on a very different side of things depending on the issue, and saying, what are the things you absolutely need? What are the things you absolutely can't support? And then let's work from there. And we can find bipartisan, durable policy by working together. And that is absolutely what I'm committed to doing. It's what I've proven capable of doing at the state level. And I look forward to working with my colleagues on either side of the aisle to get work done for Americans. Thanks.
Well, thank you, Dr. Dexter. I don't know if this is a sad moment or a happy one, but this will be our last question of the night. So question 4. Dr. Dexter, I think you'll be first. But in 2022, Oregon voters passed Measure 111, which enshrined a right to affordable health care in the state constitution. For Black Oregonians, access to health care and health outcomes are marred by acute racial disparities. Black Oregonians have a shorter life expectancy and have less access to primary and preventative health care than their white counterparts. If elected, how will you work towards providing health justice for all Oregonians?
Thank you so much for elevating this. It is something that those of us in healthcare see across our ICUs and our hospitals much more than in our clinics, unfortunately, because exactly what we're saying. People don't have access to the primary care, the preventative care, the community health workers, the social workers, the social needs being addressed. People are working too hard, and they don't have the ability in the middle of the day to make an appointment 3 months in advance to get people to in their family to the doctor or their nurse practitioner or whoever their clinician is. We need to center people. And that is frankly, again, I'm sorry to keep bringing this up, but I'm here talking with other healthcare providers about exactly this issue. We need to center people. And what that means is making healthcare accessible, affordable, and high quality. And we cannot do that without disproportionately investing in our lower income and marginalized communities. It's not all lower income, it's culturally competent care. Having people who look like you when you go to the physician, it should be people reflecting your own values and your own comfort in your own community. We need to invest in communities of color so that they have access to apprenticeships and elevated opportunity in healthcare professions. We need to make sure that school-based health centers are robust and throughout every district, because in the end, people trust their schools more than they trust a governmental office or a doctor's office. And if we can bring healthcare in a culturally competent way to our communities, people will be able to access it much more. Can you imagine being able to let your child see their doctor within their own school, or see their nurse practitioner or their community health worker, and have their parents join virtually so that they can do it from work or wherever they are? We can do that, and we must do it. And the way to make that happen is being innovative and being thoughtful about what people need. Access to translation services, making sure that people understand when their appointments are, because frankly, not everyone has access to the internet to be able to get that reminder that they have an appointment. There are simple things that we need to do, but the biggest one is centering people and making it accessible, affordable, and high quality.
Thank you for your answer, Dr. Dexter. And Joanna Harbor, you have 3 minutes for your answer. Thanks.
Thank you. So it's very important that everyone does have access to doctors, especially the preventative side. We want them to have access when there's an emergency, but we'd like them to get to the doctor before the emergency so we can prevent the emergencies or maybe stop the chronic diseases. Would be the ideal thing, is to get people so that we're actually more healthy and we need less doctors visits. But to get to that point, we need to make sure that everyone has healthcare that they can access and they can understand, and they can also understand how to get access to the doctors. A little while ago, I took my mom to get a blood draw. She's 74. And she probably didn't just appreciate I aged her a little bit, but she needed to get a blood draw, and I was able to take her there and walk her through a very complicated, you have to register online through this online program. When you get there, you have to use this electronic device thing to register. There's no person there to help. And we had followed all the steps and her appointment was gone. And there were a bunch of other senior citizens who were there that the same thing happened, and they got their appointments cut. Some of them had to leave. Some of them they were trying to fit in. And it just became, I guess, a nightmare. And I have no idea what was going on, but we can't have something like that because we have no idea if those seniors had follow up and they didn't have someone who was there with them to be an advocate. And so we need to get away from making things so complicated that the average person, whoever it is, whether it's senior citizens, minority groups, or whoever, we need to make it so that it's easy so everybody can use it. And so I think there's a lot of changes and things that we can make. And we need to also realize, though, what will work in Oregon may not work in Texas. And so we have to be cognizant of that type of thing and make sure we're not making it so that it's so wonderful in some states, but then Oregon doesn't have a good way of it, or vice versa with Texas, because every state is fundamentally different. So that also needs to be taken into consideration when we're looking at these things. But I agree that access to healthcare for everyone is fundamental, and it does need to be made easier for all and less complicated. And like I said, the ideal thing is to actually make people healthier so they don't need the emergency visits.
Well, thank you very much, both of you, for your answers. Thank you, Joanna Harbor. We will now conclude with closing statements from the two candidates, and we're going to begin with Joanna Harbor. Joanna Harbor, you have 2.5 minutes. What would you like us to know?
Thank you. I appreciate Dr. Dexter being on here, and I appreciate again the Urban League for providing this forum and all their sponsors or supporters. With regard, basically, I've met Dr. Dexter now a couple times through Zoom and in person. She seems like a really nice person, a really good person. So and hopefully the same is true of me, that I'm a really nice person as well. And so truly what you're looking at, it's going to be the difference of policy ideas and whose ideas you like better. Nobody here is trying to figure out the best way to say that. We both have different ways of approaching things. And so you just need to realize whose ideas are better. You can go to my website and look at what my platform is. You can go to her website and look at her platform. And my goal is to go back there, repair the economy, secure the border, bring about school choice and parents' rights, and healthcare, and balanced budget. There's so many things we need to go back there and do. And if the voters of CD3 give me the opportunity, I would be so happy to go back there and fight for them like I have fought for my legal clients and represent them to the best of my abilities and hopefully make them proud. And I appreciate the opportunity to have this time with everyone tonight. And thank you again to everyone for bringing about this forum.
Thank you for your closing statement. Dr. Dexter, your closing statement, please.
Thank you so much. Again, thank you to the Urban League, to you, Mr. Mundy, and to Joanna for having this conversation. And you are, I absolutely agree, a nice person and somebody who I do think it is a difference in values and priorities, not a difference in whether or not we care about our communities. And that is what I've seen throughout my time in the Oregon legislature as well. I have very close colleagues who are Republicans, and I think that that is really key. I think most of us have friends and family members and people who think differently. And what is at the core issue for us right now as a country, I would say we need to make sure that our democracy is secured, that we center people who are struggling, our working families. They need access to opportunity and to stability that we aren't seeing right now. Healthcare must be affordable. Transportation needs to be readily available and affordable. There's so many opportunities for us to do better, but none of that will work if we don't get to working together. So that is priority number one. Congress must work after securing our democracy. I am very afraid. This is an incredibly important election, and we cannot take our democracy for granted. So I believe tomorrow is the last day to register to vote in Oregon. I hope everyone is registered, that we are all going to show up. It is the most powerful thing that we have is our vote, and to make sure that we are represented. And I couldn't agree more that I will serve with all my heart. My children are my reason. My patients are the motivation to be here. Seeing people struggle and have no hope is something that I cannot stand by and wait for. I want to do the work, and I look forward to working with my communities. My career has been built on taking care of people. That's how I'm going to show up in Congress. And I really hope that the voters of Congressional District 3 will trust me and give me that opportunity and privilege to serve. Thank you.
Well, thank you, Dr. Dexter. Thank you, Joanna Harbor. And I'm going to close out now with some thanks. So as tonight's candidate forum ends, well, first I want to thank you two both for some very civil discourse, which I truly appreciate in today's climate. But I also wanted to thank our partners at LNS Captioning and Open Signal, who are airing this forum. We thank both candidates for participating tonight, as well as those community partners. I also want to again highlight the importance of voting. Each one of you said it, but it's true. The deadline to register to vote for the election is tomorrow, October 15th, and election day is November 5th. Democracy only works when people vote, so get registered if you are not, and vote. At the Urban League of Portland, much of our work is done with local partners who have a deep commitment to our shared values. We'd like to thank the following real-time partners: Reimagine Oregon, NAACP of Portland, Fair Housing Council, SEIU 49, Welcome Home, the Coalition of Black Men, Kairos PDX, Muslim Educational Trust, Women's Foundation, YWCA, Impact Northwest, Children's Institute, NEA, Latino Network, Northwest Pilot Project, and Self-Enhancement, Inc. And that's just a smattering of the collaborations that the Urban League has. But in closing, please remember that the Urban League is a nonprofit that relies on donations and membership to serve the community. It is through your generosity that the Urban League of Portland can host forums and other events like this. Again, tonight's event was part of the Urban League series of virtual candidate forums for the general election. Please visit ulpdx.org to learn more about our series of events. And if you need assistance voting, registering during the election season, the staff at the Urban League are ready to legally talk with you and help you with that. Reach out via our website, social media, or call 503-280-2600 for assistance. On behalf of Urban League's President Nkinge Harmon Johnson, the Board of Directors, and all of our members, I thank the audience for joining us tonight. I am Marcus Mundy, the Executive Director of the Coalition of Communities of Color. Thank you to both candidates, and good night.